Dr. Megan Williams from the Croakey Connective and from Uni of Technology Sydney. I'm here on Wiradjuri country in Albury. We've just had Croakey go and we've connected here to talk about health justice partnerships as well as all manner of other things related to public health when we're walking. So yeah, welcome, and would you like to introduce yourselves to the viewers? And
Thanks. Yes, I'm Karen Bowley. I'm a lawyer at the Hume Riverina Community Legal Service. We cover both southern Riverina of New South Wales and the northeast of Victoria, and we have a couple of health justice partnerships actually. One with Gateway Health in Wodonga and Wangaratta, and then the one with the Albury Wodonga Aboriginal Health Service, which is it's set up in Albury, but it's a cross-border service also.
And how long have they been going, the health justice partnerships?
Gee, that's a good question. Well, we started off going to the Albury Wodonga the Aboriginal Health Service about 2008, I think it was, but we were only there for about 2 hours a week.
Yeah.
And it really wasn't taking off. We didn't get a lot of clients.
Yeah.
So we've started since October last year, going 2 days a week.
Right.
So I sit at the health service.
Yeah.
And people make appointments at the reception at the health service, not with our service.
Yeah.
We were noticing though for a number of years that we weren't getting any Aboriginal clients.
Yeah.
And they weren't obviously comfortable coming to our office in Wodonga, so
Yeah.
we were trying to find a space where they felt culturally safe so we could
Yeah.
talk to them about their issues. And
Yeah.
as you know, doctors are one of the places where people do actually raise their issues, all sorts of issues, not just medical issues, and legal issues is one of those.
And with Aboriginal medical services being set up as places where health is holistic and you can access a number of services on any one day,
Yes.
it's great to see that legal issues aren't left off that agenda.
Yes. And they also make the appointments and also make sure that the client can get there. They have their own transport bus, to get people to the appointments. So that's also fantastic.
Yeah, really improving that accessibility of the service, getting there on time. How many people, would you see coming in on an average week?
Well, my Wednesdays are actually usually very busy. I'd probably see maybe half a dozen people on a Wednesday and a couple on a Thursday. But as I said, we've only been doing this since October.
So it's quite new
Yes,
still.
and I had all of January off.
Oh yeah, that's good. Good work-life balance, hopefully.
Yes.
Yeah.
Yeah.
And Karen, just sort of generalising, like what type of issues do you address in the work? Are they kind of civil or are they?
It's mainly civil.
Yeah.
Debts, fines. We do a little bit of family law, child protection. Traffic offences, family violence.
Yeah.
We also have a project funded through the Victoria. Is it the Victorian Law Foundation? It's called Invisible Hurdles, and it targets young people up to the age of 25 who will come in contact with family violence or might come in contact with family violence. Yeah. And my position at the Aboriginal Health Service is also part of that. And we have another lawyer who goes to Nisei and I've forgotten it. The other one is the Flexible Learning Centre.
Right.
Yeah.
Okay.
To target youth.
Right. And what was Nisei again?
North East. No, I don't know. It's youth. Something to do with youth.
Sure. Yeah. Being from very far removed from the current world of Sydney that I live in.
Yeah.
But actually in Sydney, about 3 years ago, participated in the development of a sort of statewide group of health justice partnerships that Legal Aid had hosted, and there were many services around the table: Mental Health Commission, hospitals, and a couple of community legal services, pro bono legal services as well. It was interesting that there were no Aboriginal medical services at that time attending, but there was certainly a big effort made to start understanding what Aboriginal medical services were doing and how community legal services work together with those.
Yes.
And then in that time, there's now a National Health Justice Partnership project as well. So I know that they're really reaching out and hoping to have a really solid Aboriginal strategy to go forward. And,
Yes.
and then there's all the lessons from the US as well in
Yes.
health justice partnerships.
So I attended at the end of last year the Australian National Health Justice Partnership inaugural conference.
That's right,
Yeah,
great.
and they had a speaker there from the US.
Right, yeah.
And Summer,
Yes.
she was there and she was a guest
You
speaker.
did, yeah. Yeah.
And we also heard from the CEO of the Aboriginal Medical Service in Darwin, and that was very, very
Yeah.
interesting.
Yeah, so important, aren't
Yep.
they, for cross-fertilisation, sharing lessons,
Yep.
just supportive relationships as well. Yeah, too. So, I mean, the future, hopefully is looking positive in that regard, breaking down those barriers between
Yes.
really two huge institutions in
Yep.
government,
Yep.
health on the one hand and
Law on the other.
law on the other. But certainly a lot of work to do. I know from a researcher perspective, there's really not many researchers right at that nexus, and from an Aboriginal perspective either. So, really, big shout out to all of those of you who, can participate to work together with our Aboriginal medical services and understand your impact.
Yes, and they've been so welcoming and so wonderful.
Yeah.
And I talk to the staff every now and again at the staff meetings. I go to all their staff meetings, and I get a lot of referrals, obviously, from the staff.
So it's about embedding a bit more within, and you getting known and
Yes.
trusted, and
Yes.
just being there, being present, more than just the 2 hours, but
Yes.
the 2 days.
Yes. And next week we've organised a wills workshop day for Aboriginal people. So some Sydney's lawyers from Sydney are coming down to take instructions and draft wills, powers of attorney and enduring guardianship for free for Aboriginal people, and that will be at the Aboriginal Health Service as well.
Wow, there you go. Well, someone who's had a will party, I know how relieved I felt once all of that was done, and I sometimes check on the shelf, yep, the will, it's still there, and it's something that's just too easy to overlook.
Yeah.
It's not a priority when you're faced with, enormous range of other issues. Step back. Yeah, so good on you, and it is unfortunately still like an emerging area, isn't it? We're still learning.
Yeah, but I think the Albury Wodonga Aboriginal Health Service is just marvellous. They're also registered for work development orders in New South Wales.
Yep.
So it's possible, when people have a lot of fines, that we can refer them to different practitioners at AWAS to work off those fines.
I know I'm familiar with one in Western Sydney where people can attend healthcare appointments and group programs, and it works off.
Or counselling.
State
that's
recovery.
right.
Yeah, so
It's a great system.
the evidence around that too, there's a real gap, and it'd be great, from a researcher perspective to sort of understand, or how can we work together and understand the reach, the impact of those things, and really argue for their expansion. So, it's a big country, and New South Wales has got, shocking and high rates, but in other parts of the country they're higher and worse. So, I'd love to, pass this on wide to others and inspire them.
It's a great partnership, and I think it's working really well, and can only get bigger and better. And the more of them there are, the better. Reconciliation also it's a great way to go about that, isn't it? And getting to know each other and
there's specialty skills areas that are so separate yet complementary, aren't they? Law on the one hand and public health on the other. And, our uni student numbers of Aboriginal people are just so low, but these are real key areas. It's about you being there to bring the next generation through on a placement or on a visit, or to be inspired to work across the disciplines, not just in the individual disciplines. It's the magic of really addressing law as a determinant of health.
The psychologist actually at AWAS has said to me that he had a client he was working with who he discovered had, some huge amount of fine, like $10,000. And when that was resolved with the assistance of a lawyer, the mental health of that client just improved so much. It had actually been weighing him down for such a long time, but he probably didn't realise.
No. And then when you don't realise, that's where you make your decisions from. That's where your relationships emanate from. Your hope for the future as well.
So his life was spiralling down just because of that huge burden that he had.
Yeah.
Didn't know how to resolve.
With physical implications, mental, social.
Yes.
Yeah, definitely emotional as well. Yeah, so, well, keep doing what you're doing, and thank you so
Thank you.
much for your time and inspiration.
Thank you.